Now we shall describe the surfaces of the hip bone one by one. Gluteal surface, which is often considered to be the outer surface of the ilium, since this iliac fossa represents the pelvic surface or the inner surface of the ilium. Gluteal surface, the name is indicating, faces the gluteal region and gives attachment to the gluteal muscles of the same region. It is irregular surface having been thrown into different lines, out of which at least 3 lines are visible, either completely or incompletely to the naked eye. These lines are called gluteal lines. We have a posterior gluteal line, we have a larger anterior gluteal line, and then we have more inconspicuous and smaller line called the inferior gluteal line. The posterior gluteal line extends from a few centimeters in front of the posterior superior iliac spine, and almost in the lower part extends up to the upper part of the greater sciatic notch. It may or may not be visible completely in its lower part. Anterior gluteal line, which can almost completely be seen with the naked eye and is the longest line among the gluteal lines, extends a few centimeters behind the anterior superior iliac spine, runs posteriorly, backwards, then downwards up till the upper border, middle of the upper border of the greater sciatic notch, just anterior to the posterior inferior iliac spine. The shortest and more inconspicuous line is the inferior gluteal line, which extends roughly between the anterior superior iliac spine and anterior inferior iliac spine, continues to move backward till it reaches the apex of the greater sciatic notch. It lies just above the acetabular fossa. Next surface is the iliac fossa. Iliac fossa represents the inner surface of the hip bone, ilium, its iliac part. A layman may also call it flank. It's relatively a smooth surface, slightly hollow, because of which it is often referred to as iliac fossa. It is present in front of the medial border, which we earlier described to be separating the iliac fossa from the sacropelvic surface of the ilium. Third surface and the last surface of the ilium is called the sacropelvic surface. Sacropelvic surface represents 3 important bony landmarks: an iliac tuberosity, an auricular surface, and a pelvic surface. This sacropelvic surface is located posterior to the medial border of the ilium, which again was separating the iliac fossa anteriorly from the sacropelvic surface posteriorly. Sacropelvic surface represents three bony landmarks: an iliac tuberosity, which is a rough area above the auricular surface. Auricular surface, as the name is self-explanatory, resembles an ear, hence named as auricular surface. It is a smooth area that articulates with the sacrum to form the sacroiliac joint, whereas the iliac tuberosity is rough area that lies superior to the auricular surface and provides attachment to the various ligaments related with the sacroiliac joint. Next, we have the pelvic surface, which is the antero-inferior part of this entire sacropelvic surface and is smooth and is located antero-inferior to auricular surface. Along the upper border of the greater sciatic notch, this pelvic surface represents a deep area called the preauricular sulcus. This sulcus is of clinical significance when it comes to gender difference of the hip bone between male and female. It is supposed to be deeper in females than in males. So this was all about the bony features and introduction to hip bone and bony features of the ilium. In the next lecture, inshallah, we shall cover the bony features of the remaining parts of hip bone, which are the ischium and the pubis. Then we will move on to attachments and clinicals of the hip bone.